But doctor, I don't have heartburn. Acid reflux and your throat. What is reflux? Normally, stomach contents are kept in the stomach by a sphincter-type valve at the lower end of the esophagus, which is our swallowing tube. Sometimes the valve doesn't work efficiently. Reflux is the term used when stomach contents come back up into the esophagus. Sometimes they also spill over into the voice box, also called the larynx. Stomach contents are normally acidic, so they can burn and irritate the esophagus, larynx, and upper throat, also called the pharynx. What is LPR? Laryngopharyngeal reflux, or LPR, develops when stomach acid travels up into your throat. Many people don't experience heartburn or indigestion. What causes these symptoms? The main throat nerve, the vagus nerve, is responsible for detecting abnormal sensations in the esophagus, pharynx, and larynx, such as burning from stomach acids. The vagus nerve is also the action nerve, so it can cause muscles to contract in the esophagus, pharynx, and larynx. It often tells the throat muscles to tighten to protect the airway when acid is coming out of the stomach. The larynx as protector. All mammals have a larynx. The main job of the larynx, including the vocal folds, is to valve and close when something threatens the top of the airway. When the larynx is trying to close, to keep stomach acids from spilling into it, it makes us very aware of the normal structures and fluids in the throat. Our throat muscles may feel like a lump because they're valving to protect the lungs. We may notice the normal mucus because it collects in the throat where the tight muscles are protecting the airway. Common symptoms of LPR include post-nasal drip, a sensation of drainage down the back of the throat, or excessive mucus, a feeling of something caught or a lump in the throat, sometimes a tickling or burning sensation, throat clearing, especially when you first wake up, difficulty swallowing, chronic coughing, sore throat, especially when you first wake up, hoarseness, especially when you first wake up, throat hypersensitivity. A combination of irritation from the stomach acid and reaction of the throat muscles to the acid invasion may make our throats very irritable and hypersensitive to normal throat activity. Throat muscles that typically relax to help us swallow may feel tight, so swallowing is effortful. We may be overly aware of the normal drainage of throat fluids flowing down the back of the nose. The throat may feel irritated and sore, and this may get worse if we talk. The throat may react too strongly to irritants like dust particles, changes in temperature, or odors, making us cough and clear our throats. Because the larynx is trying to protect our lungs, our vocal folds cannot relax to vibrate easily, so our voice may be hoarse, tense, and restricted. Morning symptoms. For many people, the most severe episodes of reflux occur while they are lying flat. While we are sleeping, our throats and stomachs are on the same plane, so stomach contents can flow more easily into the throat. This is why LPR symptoms are often worse first thing in the morning. Treating LPR. For many people, LPR is a chronic issue that can be controlled by lifestyle changes. The key to controlling reflux is keeping stomach contents in the stomach and minimizing the acid content of any reflux. This can be achieved in most people by optimizing meal schedules and diet, adjusting your sleeping position, and losing weight if necessary. Gravity and the throat. When we're upright, gravity helps keep stomach contents down. Stop eating at least 3 hours before going to bed or before lying down to relax. Avoid alcohol or caffeine late in the evening. Elevate the head of your bed 4 to 6 inches by placing blocks or bricks on the floor under the legs at the head of your bed. Caffeine and the throat. Caffeine opens the valve at the bottom of the esophagus. It also acts as a diuretic and dehydrates the throat, which makes it more irritable. Cut out caffeinated beverages and foods. Avoid coffee, tea, chocolate, and caffeinated soft drinks. Carbonated drinks also create more gas and burping, which increases reflux. Nicotine and the throat. Nicotine is another chemical that opens the valve at the bottom of the esophagus. Cigarettes also have a diuretic dehydrating effect on the body. Stop smoking to reduce reflux and to save your life. Meal size and diet. Certain eating habits make LPR worse. Eat small, frequent meals, rather than skipping meals and eating a large dinner. Eliminate fried, fatty, and spicy foods from your diet. Avoid onions and garlic. Avoid juices and fruits that are high in citric acid. For example, oranges, grapefruit, lemons, limes, cranberries, and tomatoes. Your general health and LPR. Extra body fat around the abdomen increases pressure on the stomach and promotes reflux. Try to achieve and maintain optimal weight. Don't wear tight belts or waistbands. Avoid leaning forward after meals and snacks. Tension in abdominal muscles increases pressure on the stomach and promotes reflux. Learn relaxation techniques to improve posture and release abdominal tension. Medical treatments. Antacids are available over the counter and may be used to neutralize stomach acid. They should be used 1/2 hour after meals and before bed. Prescription medications. The most commonly prescribed drugs for LPR are called proton pump inhibitors. Your doctor may want you to try these medications for a minimum trial of 3 months. For more information, see your doctor.